Greetings to our returning viewers and a heartfelt welcome to those joining us for the first time. I'm Jamie, and we're here for the 9th installment of the UPSC series. Today, I'll offer a succinct overview of immunotherapy and targeted therapy. I have touched on this subject in a previous video, but would like to go into it once again here to include information pertaining to some of the immuno and targeted therapies that are more commonly used to treat UPSC. I've chosen this topic because you're likely to come across the abbreviations for these therapies during your treatment or while researching clinical trials, and this way you will be somewhat familiar with them when you encounter them. Before we dive into today's discussion, I'd like to provide a brief health update. I was diagnosed with stage 4B UPSC in 2017 and have undergone various treatments including chemotherapy, immunotherapy, and targeted therapy. I've just completed my 40th treatment with Keytruda, which I started almost 2.5 years ago. As of the date of this video, I'm happy to share that there's still no evidence of disease. Recent discussions with my healthcare team have led to some positive changes in my treatment plan. I'll be transitioning to a CT scan every 6 months instead of every 3, and my infusion schedule will now be every 6 weeks instead of every 3. It's worth noting that the Keytruda dosage will increase from 200 milligrams to 400. With that update out of the way, let's dive into today's episode. Immunotherapy is a type of cancer treatment that uses substances made by the body or in a laboratory to boost the immune system and help the body find and destroy cancer cells. It can be used alone or in combination with chemotherapy and/or other cancer treatments. Monoclonal antibodies, on the other hand, are clones of your body's antibodies that are made in a laboratory meant to stimulate your immune system. They are exact copies of one antibody. The generic names of the monoclonal antibodies often include the letters MAB at the end of the name. Some monoclonal antibodies are classified as targeted therapies because they have a specific target on cancer cells that they aim to locate, bind to, and attack. In contrast, others function as immunotherapy by enhancing the immune system's response, making it more effective in identifying and combating cancer cells. Additionally, certain monoclonal antibodies can serve as checkpoint inhibitors. An immune checkpoint is like a brake in our immune system. It's a control mechanism that prevents our immune cells from attacking healthy cells in the body, allowing our immune system to distinguish between friend and foe. An immune checkpoint inhibitor is like a key that unlocks the brake on our immune system. It's a type of therapy that helps our immune system become more active by removing the brake, enabling it to better fight against diseases like cancer. Here are some examples of checkpoint inhibitors. Pembrolizumab with its brand name Keytruda, nivolumab with its brand name Opdivo, atezolizumab with its brand name Tecentriq, and dostarlimab with its brand name Jemperli. Targeted therapy is a type of cancer treatment that works by blocking specific molecules or pathways that are involved in the growth and survival of cancer cells. This allows targeted therapy drugs to kill cancer cells while leaving healthy cells unharmed. Cancer cells need specific molecules, often in the form of proteins, to survive, multiply, and spread. These molecules are usually made by the genes that cause cancer, as well as the cells themselves. Targeted therapies are designed to interfere with or target these molecules or the cancer-causing genes that create them. Doctors may perform genomic tests to look for abnormalities in the tumor, DNA, or blood. This can determine which genes are mutated or have extra copies, and if there are gene abnormalities that can be targeted. Tyrosine kinase inhibitors, or TKIs, are a type of targeted therapy that target proteins involved in cell signaling pathways. Cell signaling pathways are like the roads and bridges in a city. They allow different parts of the cell to communicate with each other and coordinate their activities. An example of a TKI is lenvatinib, with its brand name being Lenvima. PARP inhibitors are a type of targeted therapy that blocks the activity of the PARP enzyme. This enzyme helps to repair damaged DNA. Cancer cells often have DNA damage, and PARP inhibitors can make it more difficult for cancer cells to repair their DNA. This can lead to cancer cell death. PARP stands for poly-ADP ribose polymerase. An example of a PARP inhibitor would be olaparib, with its brand name being Lynparza. EGFR inhibitors, also known as ERBB1 or HER1 inhibitors, are drugs that bind to certain parts of the EGFR and slow down or stop cell growth. EGFR stands for epidermal growth factor receptor. An example would be afatinib, with its brand name being Gilatrif. HER2 inhibitors are a type of targeted therapy that targets the HER2 receptor used in HER2-positive cancers. Herceptin, with its generic name trastuzumab, is a HER2 inhibitor. VEGF inhibitors are another type of targeted therapy and work by blocking the activity of a protein that helps to promote the growth of new blood vessels. By blocking VEGF, targeted therapies such as Avastin, with its generic name bevacizumab, can help to starve tumors of the nutrients they need to grow. VEGF stands for vascular endothelial growth factor. These are just a few examples of the many immuno and targeted therapies available. The choice of therapy for UPSC depends on the molecular characteristics of the cancer cells and the patient's individual profile. Treatment decisions are often made based on extensive testing and evaluation, and there are many other drugs and therapies in development, and new ones are being approved all the time. It is important to note that not all immunotherapies and targeted therapies are effective for all types of cancer. Your doctor will work with you to determine the best treatment plan for your individual case. Well, that concludes this episode. Thank you for tuning in. If you have any questions or comments, please feel free to share them in the comments section below. If you found this video informative, don't forget to show your support by liking, subscribing, and hitting the bell icon to stay updated on my future releases. Sending love to you all, and I look forward to seeing you again soon.